Hello everyone, thank you for joining us. We are here live at HIMSS22. I'm Nasim Afsar, Cerner's Chief Health Officer, and I'm thrilled to be joined here by Dr. Usmani from Intermountain Health and Dr. Reddy from Adventist to talk about the recent HIMSS7 validation. Thank you so much for joining us.
Thank you.
Can I ask you both to do a brief introduction, Dr. Usmani?
Sure. My name is Farukh Usmani. I'm the Medical Director at Intermountain Healthcare, Medical Director Care Transformation. And I have been involved in primary care physician by practice, but have been involved in medical informatics for the last 15 years and in the computerized physician order entry systems. And it has been a good journey, and we look forward for much more.
Wonderful. Dr. Reddy.
Dr. Rakhal Reddy, Assistant Medical Director, Health Informatics for Adventist Health. I've been with AH for 5 years. I represent 20 hospitals, over 300 clinics. My background in Cerner, I use it as a resident and seen it grow over time. I think I had the first implementation of FirstNet when I was a resident. I was just remembering that. But yeah, happy to be here.
Got a bit of history there.
Yeah, that's right.
Wonderful. So congratulations are in order as you have both reached the HIMSS7 level. And our audience was interested as you think about that journey. Share with us a little bit kind of what was surprising as you went through that? What was something that stood out to you in that journey? And Dr. Reddy, maybe we'll start off with you.
Yeah, so I think what the surprising thing to me as we went through the process was the engagement of everybody across Adventist Health. I have to say I'm just one person on the team that accomplished the HIMSS7 validation. We had nurses, MAs, practice managers, and understanding how impactful the health information technology was to them was surprising to me. Usually in a CMIO type job, you hear a lot of complaints about the tool, but surprisingly enough, the engagement was the biggest surprise to me, a very pleasant surprise actually.
It's really wonderful. Dr. Usmani?
Well, the surprising factor was how they focused it on patient engagement and availability of making the interoperability, patient engagement, the ability to reach virtually to patients. Those things were it's spot on. It's the need of the time. So it was very important that those things were included in this validation, and these validations help set benchmarks for HIMSS. And HIMSS models are great. HIMSS models are basically great benchmarks, and organizations at stage 7, they basically provide a lot of value to HIMSS because these organizations help set up the benchmarks and further strengthen HIMSS maturity models. So I think collectively the ask for patient engagement, collectively the ask for reaching out virtually, enhancing video visit, e-visit, these were things that were really appreciated by the clinician community, and I feel that it is very important and right time to dwell into all this and explore and help us validate on those standards.
Yeah.
That is very important in today's, given the COVID scenario, given what we are, healthcare is looking today. I think it is very important to get those perspectives in place and move our journey further.
You know, I'm so happy to hear about the focus on person-centered care, which is something that as healthcare delivery systems we're all trying to do across the U.S. and across the globe. Mm-hmm. I'm wondering if you can give an example of a specific person-centered initiative that the institution worked on.
Oh, absolutely. There are a couple of them. If I start with virtual care, we have the capability, Intermountain Healthcare has the capability to reach patients virtually. We are reaching patients virtually of all age groups to all community locations. There were several examples that we have shared in our case studies even about antimicrobial stewardship, about critical care, about behavioral health crisis management, and we even have the ability to reach out, provide hospitalists for skilled nursing facilities. Patient engagement overall, and apart from that, e-visit. e-visit basically enables the patients to communicate their questions with the help of a symptom checker chatbot, which basically translates all the questions to the note in iCentra, in Cerner Millennium application. Physicians look at that note. If they have a question, they can reach out to the patient, ask questions, and then write the treatment plan, medications, and patients are able to get asynchronous care from the comforts of their home.
You know, that asynchronous component is fascinating. We're having a conversation not too long ago about the fact that if you look at Amazon, it didn't just change how the timing of when we shop. It really changed how we shop, right?
Exactly.
It connected us to a much broader world of vendors. It meant that I could shop at 10:30 p.m. when my kids went to bed, as opposed to having to hit stores during regular hours. And I think that an asynchronous component that you're talking about, again, enables people to get care and be able to get treatment at a time and in a setting that works for them, versus it's got to be at this time in this way to get that. So that's really fascinating.
Exactly, and to emphasize more on this, the beauty is that the artificial intelligence component is embedded there. The patients are taking that questionnaire, answering that questionnaire. It gets converted into a note in Cerner Millennium application. Physicians look at it and they have the time to ask questions if they have additional questions. So if I'm a physician, if I wear my physician hat and I say, oh, I have to ask another question, I have the ability to reach out, reach back, and then appropriately write a treatment.
Yeah, that's a great point. Dr. Reddy, again, as you look at your journey, any examples of person-centered care or patient engagement that the team led at Adventist?
Yeah, so I think like many other health organizations during the pandemic, we looked at ways to disrupt this, the standard way of seeing patients. Certainly, our patient portal journey was accelerated, some of that, but we actually implemented a hospital-at-home model, and talking about meeting patients where they are, where the care is needed when they want it versus them having to travel. And Adventist Health, we're very rural in some areas. So those patients, we need to meet them in the comfort of their homes. So we've developed a model of having a central nursing in some of our areas of our footprint, and are monitoring the patients remotely. And it's been wildly successful, actually. Our HCAP scores in those spaces are excellent, because the patients feel naturally we all want to be at home, to get better.
And I think to add to that, to Rakhal's point, we have 24 hospitals. The 25th one is a virtual hospital, and we've got validated that as well from HIMSS. And I think that virtual hospital is providing care to the rural communities in Utah, and I think the ability to reach through the clinical clinical application to the rural community, remote communities, locations in Utah and Idaho, I think that is remarkable, and we are taking benefit from that.
It really democratizes care, right? And it enables us to care for patients that we would have never been able to in the past. As a hospitalist, hospital at home is near and dear to my heart, so it always makes me very happy to hear we're stepping outside of the four walls of the hospital and really looking at how do we deliver that acute care, like you both mentioned with, hospital at home, virtual care. That just wasn't possible to do that a decade ago. Are there kind of other examples that got highlighted for you through the HIMSS 7 process that you would say, really showed the impact that technology has?
Yes, absolutely. I think one of the things that HIMSS now recognizes the work we have done and the ability to achieve the highest level of EMR maturity model. It's not just the EMR. It's a lot of things behind the EMR. It is the reliability of our networks. It is our design. What you would like to add into that?
You know, I think there's a lot of technologies out there, but using them smartly.
Yeah.
You know, so we're exploring several different things. Remote patient monitoring. You know, beyond the hospital at home model, looking at remote patient monitoring, trying to keep our patients healthy
outside
out of the hospital.
Outside.
You know, so you know what we've discovered in the last 2 years is there's multiple pathways here, and the hospital at home model is just one pathway. How do we take the technology and just keep them out of the hospital, keep them not getting admitted in the first place, and also our you know, high utilizers, how do we keep them healthy and understanding their disease condition? I often tell our team, remote patient monitoring is not about, it's not about just watching the vital signs and weighing the patient. It's a lot more about educating the patients on their condition and keeping them out of the hospital themselves. You know, they can understand how they treat themselves to keep them healthy.
And I think that's a really great framing with that. So based on everything that you've both shared, this is a tremendous amount of work to go through this process. Why should organizations do this? You know, we have so many competing priorities. What's the reason to invest and to actually go through the HIMSS 7?
See, basically, HIMSS validation helps organization raise the bar to improving patient care, to improve adoption and utilization in the EHR. It is a good way to take a look under the hood and make sure that everything is running the way we think it is. So we don't avoid our annual physical just because we feel good. It is always beneficial to get a good exam done by an outside body. So, and HIMSS validation is a good EHR utilization check from the leader in the industry. And organizations at stage 7 brings a lot of value because these organizations help to set the benchmark, raise the bar high, and at the same time, they strengthen future maturity models for HIMSS. HIMSS now recognizes that what we have gone through and how we have achieved. I think that is the reason why it is important that all healthcare organizations should take HIMSS validation and get a good check of EHR being utilized in the healthcare system. I think
I love the under the hood analogy. That's a great analogy.
Also like the annual physical.
Yeah,
I think that's
a great
true.
one too. I think for us, it just shows our commitment to using health information technology for engagement of our patients, for care delivery, transforming care delivery, and we've done a lot of work around redesigning workflows and hardwiring them in the EHR, and we're able to share that. And so I think more than anything, it shows our commitment to our patients, it shows our commitment to our providers, and to our communities that we are using the full power of our health IT to better outcomes.
Yeah,
well,
and functionalities in clinical applications, I think that has really helped the registries, the health maintenances in Cerner Millennium clinical applications. That has given a lot of leverage for the patient population. That there are functionalities that are being taken care of and how patients are being benefited. I think that is also great.
Well, Dr. Usmani, Dr. Reddy, thank you so much for joining us. Congratulations to Intermountain Health, as well as Adventist, for the tremendous work that it took to get to this point. We are thrilled that you were able to join us. Thank you.